the one we said turn to. You actually have 3 TB handouts, you guys. If you noticed, you have 4. There's another one in a respiratory packet that talks about the test itself. And we are absolutely going to talk about everything to do with TB. So let's tackle this one first. Okay? Now, so let's start where we started earlier before we started any recording and remind ourselves, where is the biggest TB outbreak in the history of the United States today, 2025? Where is that at?
Kansas.
Kansas, right? So in Kansas right now, they are struggling with more TB than the U.S. has ever seen. And to help you with that perspective, one of the reasons we don't get TB the way other countries do, and the reason we don't have a vaccine here and other countries do, is because our housing pattern is such that typically there's only 2, 3, maybe 4. Every now and then we'll see 6, and maybe a little bit more people in one house. It's kind of rare to have a house with 20, 30, 40 people in one house. Are you still with me? It's also kind of rare for our house to be super duper close to the next house. It's rare for most of our housing to be in apartments that have one room, and that is the whole house. Now in New York, they have apartments with one fucking room, $1,000 a month, and that's your fucking house. So that's New York. That's called an efficiency apartment. It's one room for the whole thing, and you paying $1,000 a month on that. Okay? New York is what? Crowded, right? We all know that. Well, picture New York as most other countries except the US. We are very spoiled here. If you look at Ohio, for example, and you go down your street or my street or your street or your street, you will see a house and some grass and a house and some grass and a driveway and a house and some grass. Nah, you ain't got it like that. Nah, ain't no grass, no fucking driveways. It's just house, 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 house. So TB spreads like wildfire in other countries. It kills tons of people. It is still, even with COVID, it is still, please write this down, it is still the deadliest infectious disease on earth. Even with COVID and what we went through. Honey, you got to ease that door closed because it's taped. You just got to slam on the tape. I mean, you didn't slam it. It just closed. But just ease it closed.
Oh, sorry.
You okay, baby? Okay, y'all. So remember to write that again. Now go over it. Make sure you got it in your notes. So what did we learn this morning? We learned that the most and be careful because you can confuse these two. We learned that the most contagious infectious disease was measles. But the deadliest infectious disease was not COVID. It's actually TB. We just don't see a lot of it in America. Does that help a little bit? Okay. Now, other countries have a vaccine because they have, and you may not know sociology because, you know, nursing school threw that shit out a while ago, which is why we're in the situation we're in. But if I give you a little bit of sociology, I would say to you to understand the history of the American family. At first, we used to be extended. Extended means you, your man, your husband, for those of you who got lost on that too. You, your husband or your wife had an average, are you ready? 6 to 8 kids, and mama and them was always in the house with you. They lived with you. Mom and daddy lived with you. That was just how that's how we all lived, by the way. Now, Latinos, Russians, Ukrainians, Native American, they still live like that. They still live like that. They would never dream of throwing their family away, putting them in a nursing home and all this bullshit we're doing over here. So if you can consider that we don't do that anymore, add that to the fact that our houses are spaced out and our housing is not so crowded, we do not tend to get TB. We just don't see it. We get one TB and we all like, ah! Did you hear? The lady 2 doors down and 4 countries over got TB. Oh my God, she did. What? Is she treated? Did they test her? I mean, you hysterical. But right now, as we speak, we have more TB than we've ever seen in the history of the United States in one state and one city in that state. It's a little bit of an alarm. Now, in all the other countries, because it's such a big deal, because they still have extended families and close-knit fams and big kids, a lot of kids, and they got the houses close together and everything that goes with that. In those countries, they have a vaccine, and you got to know what it is. It's called, here we go, the BCG vaccine. And on your test, that stands for Bacille, Calmette, Guerin. And this vaccine hurts. And if you have any friends that are born outside of the United States, they will show you their vaccination spot, and it's big. It is a live vaccine. So what's another word for live vaccine? Starts with an A. Attenuated. Damn. Let me write that on the board. The babies forgot. Attenuated. Attenuated or live vaccine. BCG. Remember, it is a vaccine that, and I'm going to give you the continents. Please don't confuse continent with country, because I know geography was taken out of school too. So continent is this. People born on the continent of Africa. People born on the continent of Asia. People born on the continent of Europe. All 3 automatically get that vaccine. I did not say everyone in the world. I said everyone born on those 3 continents. There are 7 continents to help you out. Okay? Because I'm dealing with a society that don't know nothing about geography. Okay, so you have to think about that. Because if you are working and you got lucky, you did your time, you earned your stripes. Let's say that you left my class, you got the kick-ass job in med-surg or ICU or wherever you went, and you did everything you were supposed to do, worked there 2 years, did what I told you, put 15% of your money in that motherfucking 401k, so you did that shit, you got your money, got your bank. Then in the 3rd year, when the interest rates came down, you went on and bought that property and maybe some rental on top. And then when you're done with that, you went on ahead and said, I'm gonna have me some kids and I would like to see them before they die. And so you decided to go part-time and pull back from med-surg or ICU and go to something a little easier. So when you come home, you ain't mad at everybody. And so then you came home, you enjoy your children, you work maybe a day or 2 a week, and you got an office job. Now, what kind of office job did you get? Well, let me entertain you. You got an office job in occupational health. What a kick-ass job that is. All you do is have people come in, put them damn masks on their face, tell them to talk for 6 minutes and see if they pass. Occasionally, you might get a nursing student that is applying for nursing school and needs to take a TB test. Let's start there. You are the occupational health nurse. Your student just came in to go to nursing school. The hospital's gonna pay for it. They just need all the little tests y'all got when y'all went to nursing school. One of the tests we need to get at baby is what? A TB test. What kind of test is that really in real life? What would you see on the test? An actual exam that you might take? What would it say? What 3 letters? Y'all forgot that was the vaccine. This is the test. Y'all forgot the test already? This is why I had to repeat myself. Okay, so you gave her a PPD. Ain't that right, y'all? And if you want to call it another word, you could say skin test, couldn't you? Okay, watch this. You ain't gonna get away with not knowing what the P, and the D stand for. Purified on your test, no abbreviations, remember that. Protein derivative. That's what the fuck it stands for. Something to just drive you crazy. That's the name of the test that you got to get as a little nursing student. So BCG was the vaccine, PPD was the skin test. It's a lot to this. Like I said, it's levels. The route of administration for this test is what? Intradermal. Not IM, not sub-Q. It's intradermal. Very good. Excellent. What gauge needle would you use? 27. Excellent. 27 gauge needle. Your LPN tearing it up in this motherfucker. Y'all RNs better step up. She didn't answer all these questions. So you got a 27 gauge needle. You're going to do an intradermal injection called purified protein derivative skin test. When are you gonna read it?
48 hours.
48 to 72 hours. Be careful with this, beloved. Let me talk to you for a minute. Sometimes nurses are busy. They're not even paying attention to what the fuck they're doing. So let's talk about one of them, because I know them personally. Monday, they get their skin test. When they got the damn skin test, they got it after work. Are you still with me? Wednesday, this dumbass went there in the morning to get it read. Has it been 48 hours?
No.
They sent her punk ass back to the unit so fast. Like, heifer, what are you doing? I laughed so I'm like, my baby, what? Why, boo-boo? Well, I forgot when you told me in class, 48 to 72 hours. I took my happy ass down there 2 days. Yeah, no. You have got to have a minimum of 48 hours. That's on your test. And they're going to give you a scenario just like the one I just gave you. Be careful. Watch the hours. Don't watch the days. Patient came back in 2 days. No. And they're going to say afternoon in there, and they're going to say she came in the morning. Nah. We ain't doing it like that. It's got to be 48, 72 hours. So far, so good? Okay, now, so if you get it read in the right amount of time, we are going to read and measure what? The duration, induration, I should have said, not duration. Induration of the actual bleb. And we created a bleb or a wheel. I'm using all the words on the test, child. We created a bleb or a wheel when we did that skin test. And you are looking at the degree of induration, not the degree of redness. Be careful with that. You are looking at the induration and measuring it. Now, the positive is confusing. So I keep your life simple. Remember, I'm keeping your life simple. This isn't actually the measurements, because the actual measurements is 5, 12, 15. No, I'm keeping your life simple. Your life made simple is you go to this test and you say, anybody with a 5 or higher is positive for the purposes of my test. Now, in real life, because I like to tell you the truth, right? But in real life, 15 for no-risk people is positive, 12 for high-risk people is positive, and 5 is positive for everybody that's immunosuppressed. Okay. Okay. Now, let's switch the game up, because you are, after all, a nurse already, and you have, after all, earned your stripes, and you do, after all, work in occupational health at this point. And you did get that nursing student who came in for her TB test so that she can go to nursing school. And you sat her down right quick and prepared to do all this. And she said, I can't get that because I had the vaccine. Is she right or wrong? Yes or no? Is she right? Yes or no? Is she right?
Yes.
Is she right or not?
Yes.
Okay, she is absolutely right. The contraindication to getting this test is a BCG vaccine. That is not known by 50% or more of nurses throughout this country. And they give it to her anyway, and they blow up her fucking arm, and then they say she has fucking TB. And she never did. Now, you won't be that nurse. You will understand that a contraindication to getting a PPD is having received a BCG vaccine in the past. Because that's a live vaccine. Of course it's going to look like it's positive. It's a live vaccine. They've already been exposed. No, because I ain't giving nobody radiation either. Glad you said it, because it's a very good guess. But listen to me. So if that young lady cannot get a PPD test, you might be inclined to say, oh, well, then she's going to have to get an x-ray. At which point, if I'm the girl, I'm like, no, the fuck I ain't, because you ain't finna expose me to radiation for no reason unless I got a broken bone up in here. What she needs is this, and she hopefully is wise enough to tell you, like my nursing student was from Ukraine, went over there to get that damn job and had to teach them all of this. And the director knew it, but the person that was doing her little thing, the little nurse, the Nancy nurse, didn't know shit. But here we go. She needs a quantiferin gold assay. This is called a blood test. A quantiferin gold assay. So far, so good? Okay, now let's talk about that, because the Cleveland Clinic, where I work, they get so many international people. Every day I work, I get international people. I get people from all over this country, and that's every day. And I was thinking when I went to endoscopy, I wouldn't get that many people from all, because I mean, don't they got colonoscopies all over the world and all over the states and all of, apparently not the quality I guess they expect. So we get people from all over the world. So therefore, if we have this international, international patient base, we also have, thankfully, which I think is a very big positive for the Cleveland Clinic, we also have an international provider base. In fact, I would dare say more than 50% of the providers, whether they're caregiver nurses or caregiver doctors, are anything but American. And if they are American, they may have been born in a whole nother country, or at least their heritage is very clearly another country. So there are so many caregivers, you're talking thousands, that have received a Bacillus-Calmette-Guerin vaccine. And so in order to test your caregiver's TB status, ain't nobody trying to get an x-ray every year. That's radiation, right? So you had to understand that's why the Cleveland Clinic only does blood tests. And what's really nice about the blood test is it's barely a drop. Okay, so it's not like they have to draw a huge tube and all this. So when you get a job there, they're gonna draw their tubes of blood and boom, you're ready. Okay, they're gonna draw it for titers on chickenpox and measles and everything else. And they're gonna add the quantiferin on top. And I mean, it's just perfect. This quantiferin gold assay is a blood test. You must know that. You have to know that. It's a blood test. The old way was if you couldn't get a PPD, you needed a chest x-ray. And that's still being done, but the quality of care, the standard, is just do a blood test. Does that help a little bit? You're not going to be crazy in real life if you see somebody getting an x-ray, but this test expects you to know the standard of care. And the standard of care is that they have to get a blood test. Okay? Now, there are 3 contraindications to getting a PPD. I only gave you one, and the one that I gave you was she's had the vaccine before. What's 2 other contraindications to getting a PPD?
That you've had TB before.
You say what now?
That you've had TB before.
Yes, you had TB before. Go on, girl, with your bad self. You had TB before. What's another one?
Pregnant women?
No, they can actually, I'm glad you said that was on the test. They can get one. They can get a PPD. You did have to know that they can get a PPD. Pregnant women can get that. But there's one more. So one was you had TB before, tuberculosis, the disease. And what's the other one? Here it is. It's a history of a positive PPD before. You may not have had tuberculosis, the disease. You may have just had exposure. Okay? So let's be real clear. There are 3 contraindications to a PPD test. One is you've had the BCG vaccine. Number 2 is you've had tuberculosis, the disease. And number 3 is you've had a previous positive PPD. So far, so good? Okay. Now, let's have a little fun. See who thinks what. That nursing student that you had before you got the second one, who was born outside the United States. The first one you had when you did the little 27 gauge, you read it for induration. That one was just, regular nursing student. She comes back in 58 hours. She gets it read and, oh, it's positive. Oh no. So she has a positive PPD. Oh God. Now she's freaking out and you're like, oh wow. Now, so here's our deal with her. Does she need to be treated if her x-ray was negative, or does she finally just get to go to nursing school? So if you think she is needing treatment, say treatment. If you think she can go to nursing school, say nursing school. Which one would you like? Let me clarify. She has positive PPD, but negative chest x-ray.
Just one negative?
She had negative chest. How many radiation exposures do you want her to have?
I think I want sputum on that.
Oh, sputum. Oh yeah, no, she don't have tuberculosis, no. But she has a positive PPD and negative chest x-ray. Her chest x-ray came back totally negative. Does she need to go to can she just go to nursing school, or do she need to be treated?
She can go.
Nursing school?
Nursing school.
Treated.
School.
School.
School. School.
School.
Treated.
Treated. 3 of you got it right. This is why we do this. Make sure you know this, because it's the #1 question missed on TV. Her positive PPD with a negative chest x-ray means that she must be treated for simple exposure. It means she must be treated for simple exposure. This is called, and you gotta know this. This is called latent TB. You heard it in the show that I gave you before we started. They said they had so many cases of latent TB. She has, and in her chart will show, latent TB. So she's a little different because you didn't just give her an x-ray because you didn't know the rules. No, you did the protocol. The protocol is if you have a positive PPD, you do get a chest x-ray. Well, she got the chest x-ray. It's negative. Can she just go to nursing school? No. She has latent TB and needs to be treated. But her treatment will only be for 3 months. She will not be treated for 9 months and a year like the other person. This is only going to be 3 months. So far, so good. You kind of got that? Now, I got to get you there with me. I got to get you to remember latent TB does not need to just go out of your office and go to school like ain't nothing going on. No, 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 no. Here's what we're trying to do when we treat this patient. And please remember this. We're trying to prevent latent TB from becoming active TB. So we absolutely do treat them. Now, next question for your test. Is this patient contagious? Yes or no, folks?
No.
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 Oh.
No, and that was also on the test. They're not contagious. In fact, remember what the word latent means. It means no signs or symptoms. If I say to you, I had a patient the other day with latent HIV, it means the only thing they got was a test that was positive. If I say I had a patient the other day with latent syphilis, it means all they had was a positive test, no signs and symptoms. If I say they have latent TB, all they had was a positive test, no signs and symptoms. Now, all 3 of them damn patients I just mentioned need treatment, but they do not have signs and symptoms. So far, so good, y'all? Y'all good? It's a lot. It's a lot to know. And it's a favorite on the test. Okay. All right. So we did a lot. Let's review because you probably got notes all up in your butt. Here we go. We know that TB is the most deadly infectious disease on earth. But here in the United States, we don't suffer from it because we don't have extended families and close housing situations. That's why. Other countries, specifically the continent of Asia, Africa, and Europe, have vaccines. Bacillus-Calmette-Guerin, or the BCG vaccine, is live or attenuated. It hurts, and it is given to these people who live in those countries. When we test or screen, because we technically, and please put that in your notes, we are technically screening when we give you a PPD. We are not diagnosing. We are screening you. It would be very inappropriate to use this test on somebody coming in your office coughing and hacking and blowing and going. You don't need no damn screen. Take your ass on down the hall. We need a sputum culture, x-ray, get you in a private room. I mean, you know what I'm saying? Okay, so no. This is a screening. When we do a screening test for TB, we do a purified protein derivative, or a PPD skin test. Another name for this skin test is Mantoux. Mantoux. Do it this way. Okay, so purified protein derivative, PPD skin test. Another name is Mantoux. This is an intradermal injection. You need a 27 gauge needle. You're going to create a bleb or a wheal under the skin. You're going to instruct the patient to come back in 48 to 72 hours. And we are going to measure the degree of induration. There are 5 numbers that I don't want you to remember. The one you want to remember to keep your life simple is the 5. If the patient has a 5, they're positive, because typically on your test is the immunosuppressed patient. They're going to make the test harder than anything. So the patient on your test is just, and this is the one they like a lot. Patient has test HIV positive, their CD4 is less than 200, their PPD is 3 millimeters. Are they positive or negative? I said 5 or more. They're negative. Don't let them fool you just because they said they got HIV and their CD4 and no. If it ain't 5, it ain't positive, okay? And a lot of people get that question. All right, so 5 or more is positive. Now, just so you and I know, because we want to kind of know our shit, you know, you don't leave up out of here dumb. You need to remember, for purposes of being a nurse, the 15 is for the no risk, the 12 is for the low risk, and the 5 is for the highest risk person. Okay, you and me, all of us in this room, assuming none of us are on chemo, radiation, or whatever, didn't get a transplant or organ transplant, we'd have to have a 15 to be positive. Does that help? Okay. All right, now, where did she go with her little PPD positive having self after 48, 72 hours? Where did we send her? She was positive, so where did we send her? She went to chest x-ray, and the chest x-ray was negative. Remember that? And when the chest x-ray was negative, does she need to be treated or not?
Yes.
Yes. What is the word that is going to be on your test? She has been exposed. So yes, this girl need to be treated. So far, so good. Uh-oh, I hope the baby in locker. Oh, she all right. Okay, so now, here we go. The word for that, for what she now has, and it'll be in her chart just like this, she has latent TB. Latent. Latent means no signs and symptoms whatsoever. That's what that word means. Okay, latent. Not late though. Please don't get it. I have people get it confused with late. It's not late. It's latent. And late has a completely different meaning. So don't do that. Okay. So latent TB means I have been exposed, but I don't have the disease. And what else does it mean? Is she contagious or not? No. Does she have signs and symptoms? No. Does she have to go home and freak her family out? No. Now, how long is she going to be treated?
3 months.
3 months. It's her business. Go home, get yourself treated, and get on out of here. Okay? Now, what if the patient comes in coughing and blowing and going and hacking and snotting and whatever else? What if that patient came into your occupational health talking about, I need to get a TB test? Where should you send that beloved soul? To their damn ER or urgent care or their doctor. Get them away from you, first of all. I mean, they could have just had a flu, but they want a TB test, coughing and blowing and hacking and going. Nah, I don't think so. Because you're going to waste their time. And they're going to think they're fine and disappear for a couple more days when they should be treated somewhere, probably isolated. You don't know for sure. I mean, you don't isolate them until you have active lesions on the x-ray.